in terms of the male factor in fertility, how do you approach that differently than you might with your female patients? And what advice do you give male patients coming in who may not be as aware of what their body is doing on a monthly basis? Because of course, men don't have menstrual cycles, and they don't have some of the same metrics that we do to track things. What kind of advice do you give them?
Yeah, well, the first piece of advice is to even come in and see me. So oftentimes it's like this conversation of, it takes two to create a baby.
Yeah.
So it's only fair that we evaluate both partners that are involved. And so that's usually the first piece of communication. The second piece, with males, it's particularly focused on lifestyle. So when we start to think about the health of the sperm are essentially like in this crazy life race to try to get to that egg, which they can only do if the mitochondria are functioning appropriately. So mitochondrial support is absolutely critical for male fertility workups as well. But the lifestyle piece is toxin. It also has a little bit more to do with physical activity and the types of physical activity, especially if it starts to or has to do with any type of physical trauma that can contribute to impacting quality of sperm. And then it's also a time piece, right? We also want to just set the expectation that even if you put in, start interventions today, that's not necessarily going to impact your chances of fertility tomorrow or even within the next week or even within the next month. What we're really shooting for is within those 90 days of when the sperm are fully regenerated to really see the impact of lifestyle pieces. So the approach to male fertility tends to be a little bit short-winded once they come in to see me, but it's really about setting expectations and really trying to highlight what lifestyle pieces that we can likely align with their partner that they can both work towards in implementing.